Hello, my name is Karshal Trevette, and today we will explore the inflammatory and immune response of the human body after a traumatic brain injury. This is a very important subject to me because while I was active duty in the Air Force, I suffered a traumatic brain injury. In 2002, when my injury occurred, very little was known about traumatic brain injuries and their symptoms. First, we must define what a traumatic brain injury, or TBI, is. According to WebMD, a traumatic brain injury can range from a mild concussion to a severe head injury. It is caused by a blow to the head or body, fall, or any other injury which results in a jarring or shaking motion of the brain. This can cause a bruising, swelling, or tearing of the brain tissue. There are many causes of traumatic brain injuries, such as car accidents, falls, sports, physical assaults, or explosions. Over the last decade, there has been more attention given to traumatic brain injuries. There has been an increase in the amount of soldiers who have returned from active duty suffering from traumatic brain injuries. The National Football League has made a documentary identifying an increase in head injuries among athletes. Traumatic brain injuries are the leading cause of death for people under the age of 45. There are over 52,000 deaths per year. TBIs do not always result in death. Approximately 150 to 200 people are severely disabled each year. There are over 5 million people in the United States who are currently severely disabled due to TBIs. The emergency rooms in the United States see 1 to 3 million people for TBIs each year. As the war in Iraq continues, the number of traumatic brain injuries grow. The DoD reports since the year 2000, there are 3 times as many soldiers being diagnosed with traumatic brain injuries, over 30,000 troops per year. The human body will initiate an immune response when it encounters an antigen or injury. The first immunological response is called the innate immune response. This is a generic or the same response for every antigen or injury. No matter what antigen the body encounters, there is no difference in the innate immune response. Immediately after an antigen is recognized, the body begins to mount a response. Some of the cells in the innate immune response are neutrophils, macrophages, dendritic cells, and natural killer cells. Most of these cells are produced in the bone marrow. Once an antigen is detected, the cells of the innate immune response travel to the infected area. One of the first things that occur is inflammation, which is characterized by redness, swelling, and an increase in temperature. This allows more cells to attempt to kill pathogens or prevent further injury. The second immune response is called the adaptive immune response. It is specific for each antigen it faces. The immune cells, like T cells and B cells, have unique heavy and light chains which allow them to interact with only one specific antigen. Unlike the innate immune response, the adaptive immune response takes 7 to 10 days. It takes time for specificity. The cells of the adaptive immune response are macrophages, nucleophils, CD4 cells, CD8 cells, and many more. The adaptive immune response is not only responsible for killing antigens, but is also responsible for making memory cells. The body will store the effective antibodies for future encounters. For example, if someone is immunized against chickenpox or has had the chickenpox virus, the body stores antibodies to fight the specific chickenpox virus. If it ever comes in contact with the virus again, the second encounter does not take 7 to 10 days. The adaptive immune response will be immediate. The immune system produces proteins called cytokines. A cytokine is a protein secreted by the cells of the immune system that can alter the behavior of the immune cells. Some cytokines include chemokines, interferon, interleukin, lymphokines, and tumor necrosis factor. Today we will focus on interleukin and tumor necrosis factor. Interleukins are specialized cytokines. There are several important interleukins. Interleukin 1, or IL-1, is a pro-inflammatory cytokine. Pro-inflammatory means it causes inflammation. IL-1 can be found in an alpha or beta configuration. There are 11 different cytokines in the interleukin-1 family. IL-1 is primarily responsible for regulating the immune response. Interleukin-6, or IL-6, is another pro-inflammatory cytokine. IL-6 is also an anti-inflammatory monokine. IL-6 is responsible for maintaining and controlling the fever. Interleukin-10, or IL-10, works with other interleukins. IL-10 downregulates Th1 cytokines, MH2 complexes, and co-stimulatory molecules on the macrophages. Tumor necrosis factor is directly responsible for stopping tumor growth by apoptosis. After traumatic brain injury, the innate immune response begins, and the brain begins to experience inflammation. In most cases, inflammation only benefits healing. However, in the brain, this is not the case. While a little inflammation helps the brain to heal, it is when too much inflammation is seen that there is a problem. The brain can swell too much and push against the skull. This pressure is extremely dangerous and could cause death. Doctors and scientists began evaluating patients to see what cytokines were present during this inflammation process. Interleukin-1 was increased after a traumatic brain injury. IL-1 is known to exacerbate neuronal injury. IL-1R is also known for the reversal of neurotoxicity. There is an increase in IL-6, IL-10, and tumor necrosis factor after a traumatic brain injury. IL-6 controls astrocyte overproduction and helps with the inflammation process. IL-10 has a neuroprotective effect. Tumor necrosis factor has been associated with the breakdown of the blood-brain barrier and regulates cytokine cascade. How do you measure cytokines? There are 3 ways to measure cytokines. The first way is a serum blood draw. This is done by a routine venous blood draw. This is the least invasive procedure, however it is the least effective. The cytokine level in the blood is always very low. The second way is a lumbar puncture. This is done by removing a small amount of cerebrospinal fluid, or CSF, from between the vertebrae. This is a mildly invasive procedure. This allows you to accurately measure the cytokine presence in the CSF. However, it does not give you an accurate amount of cytokines present in the tissue of the brain. The third way is microdialysis. This is done by removing fluid directly from the frontal lobe of the brain. This is extremely invasive, but extremely accurate. Patients who suffer from traumatic brain injuries have an increased risk for the following diseases. Parkinson's disease, a disorder of the brain which causes tremors and a decrease in motor function. Alzheimer's, a disorder of the brain which causes a decrease in short-term memory. Endocephalopathy, a disease that affects the function of the brain. Epilepsy, a disorder which causes seizures. Post-traumatic stress disorder, psychological disease which is caused by a traumatic event. In the future, we must discover better and less invasive ways to measure cytokines. Medical professionals must stop using the Glasgow Coma Score to evaluate TBIs and come up with a more detailed exam. Scientists must continue to do research to come up with a medication which can cross the blood-brain barrier to help fight inflammation.